Hi everyone. We had a fabulous response to part one of what I'm going to do, a 4-part series on face rejuvenation. I did one on deep plane versus SMAS versus skin only, which had a tremendous response. I did a recent one on eyelids, but this is going to be really part two of the face component, okay? And I'm going to call this the alphabet soup. And I'll tell you exactly why, because there's a tendency in this specialty to name things, like new creative names, to distinguish or separate or highlight a particular procedure by a particular surgeon or maybe a geographic area. And why do I call it the alphabet soup? Because I'm sure many of you have come across this, right? Let's call it the alphabet soup. ALPHABET, alphabet soup in face surgery, okay? And I always get very amused with this. This is you probably heard of this, right? You probably heard of these terminologies come across. One is called the S lift. One is called a J lift. One is called a lifestyle lift, old name but still around. There could be something called a Y lift. There's a ponytail lift. I myself come across many of these terms, and I often try to remember, okay, this is the alphabet soup. I'm going to have to understand what a patient means when they mention it, or what a doctor means when they mention it. But I'm going to break it down for you so it's easy. And I like to draw because it demonstrates things very well. So if I were to take a face, okay, and the ear is right here and the eyes are right there, right? So you can imagine this is the bottom of the earlobe, right? This is the side of the face. And I'm just going to draw a line here like this, okay? Just like that right there. So a lot of these are named after the incisions that are used to do the surgery, okay? When we spoke about it the first time, the typical incision that's used is an incision that goes, actually, this is the hairline right here. Maybe sometimes you get the side hair here. Incision can go along the side of the hair, sometimes inside the hair, goes across to the top of the ear, goes along the ear, inside of the ear, goes behind the ear, not all the way to the top, and goes across into the hair like this, okay? Just so you understand, if this is the ear, I know I'm kind of making it all look like a circle because I'm trying to draw over it, but if you have the hair kind of along here, a typical incision to do this face surgery to kind of improve all of this area is you make an incision along the hairline, sometimes inside the hairline, sometimes you even go higher depending on what areas you're trying to work on, and then you go across to the top of the ear, go along and inside the ear, underneath the earlobe, and then you go behind, behind the earlobe right here. So you go along the front, you go into the hair, you go underneath the earlobe, you go behind in the crease of the earlobe, and then you go across into the hair of different degrees depending on how extensive a surgery you have to do, because this access is needed to work on the neck. It's very hard to work on the neck if you just make an incision here. So all of this is about accessing the areas that you want to work on. I gave this person a little bit of a dorsal hump, so this figure needs a rhinoplasty. I'm sorry. But if you have the ear here, right, and you have the hair kind of coming down like this in the back, right, all of this hair, this is the neck here, Adam's apple somewhere there. So as I said, right, if this writes, I hope it writes, a little bit of brownish color. So you make an incision on various lengths along the hair, inside the hair, along the ear, around the triangle of the ear, which is this, underneath the earlobe, behind, and varying degrees of access into the hair, sometimes up to here, sometimes up to here, sometimes up to here. This incision can also extend only up to there, it could go up to there, it could go up to there, okay? All depend on the degree of surgery you have to do, the areas that you have to work on, because this is all about accessing the areas that you need to work in. If you want to work on the neck, this is absolutely necessary many times, because this is the way you can access the neck, okay, to work in the neck. If you work here, it's going to be very difficult because you have the jaw, and to overcome all of this obstruction, it's not possible surgically to do so. So that's why behind the ear is easier to access the neck here. And the amount of work you have to do will determine how long the incision is going to be. And so now, if you can imagine, right, this alphabet soup, again, to call it, if a surgeon decides to do what they call an S lift, maybe it looks like an S, like an inverse S like this, because the incision is coming from here, goes along here, and goes behind here. If you want to call it a J lift, maybe you don't do this, you just go behind like a J, like that, right? So the incision is going to be like this. If you do a S lift again, maybe you extend it here and you kind of come across and do like an inversion like that. Okay, this is essentially the alphabet soup. It's nothing to do with any specific thing. The whole point of this is limiting the length of the incision or the extent of the incision to access the areas that you're trying to work on. Okay, so don't get fooled by marketing terms called the S lift or the J lift or whatever, because the idea should be what areas I'm trying to improve. Is it the jowls that I'm trying to improve? Is it the corner of the mouth? Is it the nasolabial fold? Is it the neck? And depending on that, the surgeon has to access it whichever way that they can. Sometimes you may even have to make an incision underneath the chin right here as well, underneath the chin here. So all of these alphabet soup terminologies are based on the incision design and incision location, but the surgery that's done is all important. How much dissection you do, like we went over last time, how far you go, how many different planes of elevation you make, how you lift it vertically or across in an oblique fashion. So that's also going to be the same regardless of which way you access it to some extent, right? So that's the alphabet soup of a thing. Y lift may be the pattern of that they draw like this, where they want to elevate in a Y pattern because the letter Y is like this, right, in a sense, if you draw it out. So maybe they accentuate one part of the face here along the cheek and the jawline, and create a structure that looks like a very sharp Y kind of thing. So all of these things are essentially geometric, design-based concepts, nothing to do with actually the surgical principles, because the surgical principles are always mostly the same, right? Amount of dissection you do, how cleanly you do it, how extensively you do it, what tissues you access, what tissues you elevate, how much you elevate it, how tight you make somebody, how loose you make somebody. All those principles will not change, but you have to adapt it to the person that you're working on, and hence all these terminologies called Y lift, S lift, J lift, etc. So this is the alphabet soup of face surgery. So the next video that I'm going to make in the next couple of weeks maybe is going to be about fat grafting. I know several people have asked me to do fat grafting video, so I'm going to really try to break it down very simply so you guys understand a little bit of the science behind it, a little bit of the technique, and a little bit of the outcomes and expectations around it. Okay, hopefully this will be helpful for you guys. And please do comment and let me know if there's any other specifics that you want me to cover. Thank you. Bye-bye.